how to release the psoas and iliacus when you have sciatica, and why that's even important, coming up next. Releasing the psoas is crucial, is so important when you have sciatica. And I gave some talk about it yesterday. We're going to put the link to yesterday's video in the description here because you can't miss this. Don't miss this. And yesterday I explained some about how the psoas goes up and down along the spine, how when it gets jacked up in tension, which can happen from stress, which can happen from just how you're breathing, which can happen from your posture, all these things, right? When the psoas gets jacked up in tension, if one side contracts more than the other, it's going to pull the spine down. When both sides contract, it's going to compress that whole lumbar spine, and that can lead to sciatica, certainly, and a whole bunch of other problems. When one side pulls, the spine opens up on one side, gets compressed on the other. Either side could be your sciatica symptoms side. Yesterday, I taught you how to do the breathing. Please do that. Start with that breathing. Today, I'm going to show you very specifically how to use the soft FreeBody ball and a smaller ball, and then also your thumbs to get in there to release the psoas muscle and the iliacus. So let me tell you a little bit about the iliacus. So the psoas is the main hip flexor, runs along the front and sides of the spine, crosses the groin and attaches into deep in the femur. Now, iliacus lines the inside of the pelvis. It works together with the psoas, so they're even called the iliopsoas muscle. They're called one thing because they work so intimately together. The iliacus pulls the pelvis, the psoas pulls the spine. They attach together on the femur. They can both get out of whack, creating all kinds of shifts in how your pelvis is resting and landing, which is going to absolutely affect how your lumbar spine is landing and if the lumbar spine is being pulled off its natural normal course. As soon as the spine gets moved off of its normal course due to imbalanced tension, that's when you start having trouble. Doing the breathing practice, getting the psoas released regularly throughout your day is going to get you much further in your sciatica healing journey. The next step is to actually physically release the psoas. And I want to give you a piece of caution. I see other YouTubers out there and other teachers teaching you to take a firm, hard lacrosse ball or a firm ball, putting that in your belly, putting a kettlebell or something on top of that and putting that weight down in. I encourage you not ever to do that. Please don't do that. You have delicate structures and organs and blood supply all around this area, and specifically around the psoas. The urogenital nerve passes by the psoas, the ovarian nerve, the uterine nerve, all these nerves pass along the psoas. So it's very easy to compress them underneath a hard, firm ball. And if you go with heavy weight too quickly, that ball is going to definitely compress some of your organs and tissues. So only using the soft FreeBody ball, the soft FreeBody ball is the ticket for truly releasing your psoas muscle without your body going, uh-oh, what's that? There's this hard stone coming in here, the protective things. That's going to jack up your psoas. So don't do that. I'm going to show you right now how to release the psoas, and then we're going to attach on this iliacus release. I know this is going to serve you. I know this is going to help you heal your sciatica. Let's do those releases now. So the psoas does go from the up through the diaphragm, down along the spine, comes wider out, and then it goes under the inguinal ligament, which is right at the crease of your groin, where it then dives deep into the back of your femur with its best friend, the iliacus. So those two tendons, those two muscle and tendons come down through that inguinal ligament underneath it and pass. So we can actually access a point right on the psoas muscle right there at the groin. So our first major point in the psoas is going to be right next to the belly button. And think about that. This muscle goes down along the lumbar spine, and it's our curl and protect muscles. The main hip flexor, really it's our curl and protect muscles. So even stress can activate tension in this psoas muscle, and running, cycling, just living activates tension in the psoas muscle, and it grips onto the lumbar spine from both sides. So then it can become difficult to stand up even when that psoas is gripped in lockdown mode. So let's release it. We're going to start with a couple of belly breaths. We're going to massage it internally using the diaphragm, taking a couple of deep belly breaths. So bring your hands to your belly so that you can really feel your belly expand. And imagine you could see your diaphragm descending to push out your abdominal contents and literally massage your psoas from the inside. So we're going to take a couple of nice, long, deep belly breaths. This is the first key step in releasing your psoas. One more big belly breath. Great. Now those 2 points in the belly, one are on either side of the belly button, deep in at the spine. So we're going to start with this soft ball. I'm going to start on the right side first. I'm going to stick my finger in my belly button. I'm going to move the ball off to the side a little bit around the edge of rectus abdominis so that we can rock side to side and kind of approach that psoas from the side. So laying down on that ball, right in line with the belly button, but a couple inches off to the side. Elbows on the floor, left knee bends out to the side to just kind of lift that left side of your pelvis. It drops the right side down onto the ball a little bit more. And then you're just going to go side to side. And you might feel it gets a little tender. And you feel maybe a little bit more tenderness as you approach that psoas near the belly button. So we're just going side to side. And then now, making sure that you're right next to the belly button, right? You're gonna slowly sink your body down. If this is as far as you can go, that's great. If you can go all the way down, that's great too. You can stack your hands and support your forehead and take a couple of big belly breaths. And then you could stretch that psoas a little bit, lifting the back leg up into the air, kind of give a little extra pull into the psoas. Soft ball in the belly, right next to the belly button. Great. And then we're just going to move off that ball and go right into the second side. So we're going to take the ball, finger in the belly button, move the ball off to the side a couple of inches. Right knee now goes out to the side. And you're rocking side to side so that the ball goes right up to the belly button and then back. And right up to the belly button and back, rocking your body side to side. My experience with the psoas is that it does not respond to force very well. It's a stress muscle, really. And so if you're putting a lot of force and jamming a firm ball in there, it is not going to be happy with that. So use a soft ball. Work with your breath. Move a little slowly. Now I'm right up next to the belly button. I can feel that I'm right next to that. I'm going to slowly lower myself down, resting my head, forehead on the palms. Take a couple of belly breaths here. Now I can feel a pulse under that ball. And you have major blood vessels going down along the spine. Another reason you don't want to use a really firm, hard ball, because you don't want to damage those blood vessels, right? So now we're going to lift the leg up a couple times. I'm going to wiggle side to side. I'd like you to come up to all fours. We release the 2 points right next to the belly button. And do a little cat-cow. Just notice that your back may already be feeling freer and might be moving a little more easily. Now we're going to do the second point
that we can access in the psoas. And I'm going to show you how to get to that point. Right here on the top of the thighs, on either side is a bundle of quads tissue. So bundle of quads, another muscle that flanks the quads here called sartorius. And right on the inside of that is a little valley called the femoral triangle. You want to stay to this very edge of those quads and not get too deep in that femoral triangle because you'll feel a pulse in there also, and you want to be cautious about that. So you want to be right up close, right next to, you're going to bump into that quads tissue. So we're going to take this firmer ball, come down into that quads tissue, sweep the right leg out to the right, just below the groin, and as the ball sinks into that space, breathing in your belly, second major point in the psoas muscle. And again, you might do just a little lift. Maybe a little wiggle side to side. And then now we're going to switch to the other side. I'm going to show you again where that is. Here's that little bundle, and I'm putting that ball right to the inside of that bundle, but I'm not down here by the pubic bone. I'm up high, about halfway between the pubic bone and the outer hip. Get the ball just below that inguinal line. Left leg sweeps out to the side a little bit. The inside of the foot kind of laying on the floor. Get right up next to that bundle of quads. Maybe a little wiggle, maybe sinking down, supporting your head on your hands. Belly breaths always, and especially when you're working in the psoas. That sends a signal to the psoas that everything's okay, and it helps the psoas to soften, using the breath to help soften the psoas. And then maybe you do a little lift. Wiggle side to side. We're going to come back up and do a little cat-cow. And maybe you notice that your back is even a little bit freer. Great.
So iliacus, such a key muscle. I'm so excited that you're here to learn this release. The first thing you have to do is feel where your iliacus is. You have to be able to feel your pelvis. So bring your hands to the soft side of your waist and then find the top edges of your pelvis, these pelvic rims. They're called the iliums, right? Each one is an ilium. So iliacus lining the inside of the ilium. At the very front of the pelvis, you can find two hip points, the ASIS, or anterior superior iliac spine. ASIS is on the front points of the pelvis. Now the pelvis goes from there and then starts to come up and curl back and around. So our best access to the iliacus is just behind that very front point. And you have to kind of get up into the soft part of your waist to get into it. And sometimes bowing forward and softening your belly will give you a little bit more play in the tissue so that you can actually get your thumbs in there. And the idea, I'm gonna scoot up, the idea is that you can get your thumbs inside and hook out toward the rim of the pelvis. So I sink into my belly, push out toward the rim of my pelvis. You want to really picture that muscle and hook in. So see, I keep kind of collapsing a little bit so that I soften that tissue so I can get my thumbs right in there. Oh, it's such a tender spot. And then a little tilt and tuck of the pelvis. Do a little tilt and tuck of the pelvis. I'm going to move my fingers away so you can see where those thumbs are. And I'm pushing right against the outside rim of my pelvis. Just released. So good. Phew. Yeah, feels so much better. So you do that same thing on the other side. Find that front point of the pelvis, walk back a little bit, soften the front of your body so that you have some play in the tissue.
sink your thumbs in and then hook them outward, out toward the outside of the hip. Ooh, so that you're just trapping that tissue right in there. My thumb is right in a terrible spot right now. It's tender, right? It's not terrible. It's working hard. It's working hard. So now I'm going to tilt and tuck a little bit. And that tilt engages the iliacus and the tuck pulls it along. And then after a little while, I feel that changing. I feel that shifting. So much better. Great. So that's the main points in iliacus. There are sometimes some way in the back you could keep kind of just finding along. Usually I find another one all the way back in the back of the pelvis. It's a bit harder to get into yourself. What I find is that if you release those front points, often the tension in the iliacus will go down so much, and really you'll feel such a difference. Knees, hips, back. So now that you've learned how to do it in a chair, I'm going to get down on the floor and I'm going to show you how to release this muscle on the floor. Okay, so now we're on the floor. You're going to lay on your back with your knees bent and your feet on the floor. So get into that position so that your belly tissue is soft. If you straighten the legs out, it might be pulling on that iliacus, and that's not what you want, right? So you want the belly to be a little soft. So here I find that front point of my pelvis again, and I'm going to slide, I'm going to walk it up. See, I can feel I'm walking along this rim of the pelvis, the ilium, and knowing that iliacus lines that inside of the pelvis. So I want to get my fingers or my thumbs in the soft tissue of my belly and sink down toward the floor and then push it wide. So I'm pushing those thumbs out toward my outer hip. Oh, and there it is again. Oh, so much better. It's already released because I just released it, right? So tilt and tuck. It doesn't have to be the worst thing you've ever felt, right? Let it be a little gentle. You don't have to push really hard, just a little bit, enough that it feels special, that it feels like a special spot, right? Oh, there it goes. Great. Super good. I'm going to tilt and tuck a couple times. That left side feels so much better than the right already. So again, I'm going to come over to the right side and hook down in, and I'm going to roll towards you a little bit so you can see. Even this position would work, laying on your side so that that belly and that hip are really soft. And then you can slide your thumbs in there and pushing toward that outside, trapping the iliacus muscle there. So take a couple breaths. And tilt and tuck the pelvis. You can stay laying on your back, or you could do this kind of half roll to your side. Works great too. Okay, great. And then you just kind of explore along that inside. See how my thumbs are going toward the inside of my pelvis, just following that pelvic rim. Great. Then you want to roll back onto your back if you moved, and tilt and tuck the pelvis a couple times. You can hug your knees in toward your chest or toward your shoulders. Let them get really soft. And then feet come back to the floor. And that's it. Thanks for being here. I'm Cat Matlock with FreeBody. We just released our iliacus. You can check out a bunch of other videos on the channel. Please subscribe to the channel. Hit the little bell so that you get notifications when I'm releasing new videos. And I look forward to seeing you again soon.